A camera slowly pushes in on a rusted bone saw, its teeth dulled by decades of use and neglect. The handle, once wrapped in leather, is stained dark brown. Next to it sits a small amber bottle, the label faded but still legible. Mercurous chloride, calomel, for all ailments. These weren't relics from a torture chamber. They were the standard tools of healing in the American frontier. In every Western you've ever watched, the town doctor is a hero. Clean coat, steady hands, morphine at the ready. He extracts the bullet, stitches the wound, and the cowboy rides off into the sunset by the next scene. It's a comforting image. It's also almost entirely fiction. The reality of frontier medicine was a nightmare of ignorance, desperation, and unimaginable suffering. And the doctors themselves? They were often little more than educated guessers, armed with saws, whiskey, and remedies that killed as often as they cured. This is the brutal reality of being a doctor in the Old West. Our story begins in 1867 in a cramped medical college in Philadelphia. A young man named Cornelius Whitfield is completing what passed for medical education in post-Civil War America. 2 years of lectures, no lab work, no clinical rotations, no hands-on training with actual patients. He's never touched a living patient. He's never diagnosed a disease. He's never even looked through a microscope. In 6 months, he'll be the only doctor for 300 square miles of Montana territory. Medical schools in the 1860s and 70s were essentially profit-driven diploma mills. You paid your tuition, sat through lectures, passed a cursory exam, and received your medical degree. The entire curriculum could be completed in less time than a modern nursing certificate. Nearly a third of frontier doctors had no formal medical training at all. They were barbers who'd performed enough bleedings to call themselves surgeons, dentists who expanded their practice. In remote mining camps and cattle towns, anyone who could read a medical text and project confidence could hang out a shingle. In the spring of 1868, Cornelius steps off a stagecoach in the town of Silver Ridge, Montana, carrying a leather medical bag containing everything he owns and everything he knows about healing. Inside that bag, one bone saw, one scalpel, one pair of forceps, a tourniquet, silk thread for suturing, and 12 glass bottles of medicine. Let's talk about those bottles, because this is where the horror really begins. The largest bottle contains calomel, mercurous chloride, the miracle cure of the 19th century. Doctors prescribed it for everything: dysentery, typhoid, syphilis, toothaches, depression, constipation. It was the aspirin of the frontier, except aspirin doesn't cause your teeth to fall out, your gums to rot away, and your jawbone to literally dissolve. Calomel is mercury. Chronic mercury poisoning was so common among frontier patients that the symptoms had their own nickname, the slows. Excessive salivation, tremors, personality changes, kidney failure. The treatment? More calomel. The second largest bottle holds laudanum, liquid opium dissolved in alcohol. This was the only effective painkiller Cornelius possessed. A single ounce could mean the difference between a patient enduring an amputation or dying of shock. It was also violently addictive. Frontier America was drowning in opiate addiction decades before anyone called it a crisis. Then there's the arsenic solution, prescribed for fever. The strychnine tonic, believed to stimulate the heart. The turpentine, used internally for intestinal worms and externally for wounds. Each one poison, each one standard medical practice. Because in 1868, germ theory doesn't exist yet. Not in any practical sense, Cornelius knows that wounds sometimes fester and kill patients. He knows that women frequently die after childbirth from childbed fever. But he doesn't know why. The idea that invisible organisms cause disease is still a radical fringe theory. Most doctors, including Cornelius, believe in miasma, that diseases are caused by bad air rising from swamps and decomposing matter. This ignorance has brutal consequences. Cornelius never washes his hands between patients. Why would he? His hands aren't sick. He wipes his instruments on his coat, the same coat he wears day after day, stiffened with the dried blood of dozens of patients. He considers the stains a mark of professional experience. When he performs surgery, he doesn't sterilize anything. His saw, his scalpel, his sutures are simply wiped clean of visible debris and reused immediately. The mortality rate from post-surgical infection hovers around 40%. 4 in 10 patients who survive the operation itself die within a week from what doctors call surgical fever. They have no idea they're killing their own patients. 3 weeks after arriving in Silver Ridge, Cornelius faces his first real test. A miner named Ezekiel Harding is brought to him with a compound fracture of the left leg, caught in a timber collapse 200 feet underground. The tibia has broken through the skin, exposed bone gleaming white against dark blood. Cornelius examines the wound in the back room of the general store, which serves as his office and surgical theater. He tries to set the bone, but the break is too severe, too many fragments. The leg has to come off. Cornelius has never performed an amputation. He watched one in medical school from 30 feet away. He's read the procedure in his medical texts. Theory is about to meet reality. There is no hospital, no surgical team, no anesthesiologist. There's Cornelius, one medical text, and 3 men strong enough to hold the patient down. He gives Ezekiel a full ounce of laudanum and waits 15 minutes for it to take effect. Then he hands the miner a leather strap and tells him to bite down. He positions the 3 volunteers and removes the bone saw. The entire amputation, from first incision to final suture, takes 12 minutes. Those 12 minutes are unimaginable. The laudanum dulls the pain, but doesn't eliminate it. Ezekiel screams throughout. The volunteers struggle to hold him still as his body convulses. Blood pools on the floor. The saw binds twice in the bone. Cornelius has to rock it back and forth, working it like a logger with a crosscut. When the leg finally separates, he drops it in a zinc bucket with a wet thud. His hands are shaking as he ties off the arteries with the silk thread from his pocket. He folds the skin flaps, makes his sutures, wraps the stump in cotton bandaging. The entire operation has followed the textbook perfectly. Ezekiel dies 4 days later, delirious with fever, the stump swollen to twice its size and leaking pus that smells like rotten meat. Cornelius records it in his journal as death from shock and blood loss. He doesn't understand that he introduced infection with his unwashed hands, his unsterilized saw, his contaminated thread. He did everything right according to the medical knowledge of 1868, and that knowledge killed his patient. This is the central tragedy of frontier medicine. Earnest men trying desperately to help, armed with procedures that caused more harm than healing. Let's talk about bullets, because if there's one medical scenario Hollywood gets consistently wrong, it's the gunshot wound. In the movies, the doctor always extracts the bullet. Clean removal, a bandage, maybe a swig of whiskey, and the patient is back on his feet. Except it's wrong. In reality, probing for a bullet often did far more damage than leaving it alone. The doctor would insert metal probes into the wound, sometimes his own fingers, searching blindly for the lead ball. He'd tear through tissue, nick arteries, introduce infection. Many frontier doctors eventually learned through trial and error. If the bullet hadn't hit something vital and the bleeding had stopped, leave it alone. Some of the longest surviving gunshot patients carried lead in their bodies for decades, but the public demanded bullet extraction. It was dramatic. So doctors kept probing, kept killing patients who might have survived. Then there are the disease outbreaks, and this is where frontier doctors faced their most helpless moments. In the summer of 1869, dysentery sweeps through Silver Ridge. Within 2 weeks, 30 people are sick. Cornelius sees patients from dawn until midnight, then makes house calls until dawn again. He prescribes calomel for the intestinal distress. When that doesn't work, he tries opium. When patients can't keep water down, he attempts bleeding to balance the humors. The patients keep dying. 15 dead by the end of summer. He doesn't know that dysentery is caused by bacteria in contaminated water. He doesn't know that the town well has been compromised by runoff from the outhouse trenches uphill. He doesn't know that his mercury treatments are making patients worse. He knows only that people are dying, and he's powerless to stop it. The psychological toll on frontier doctors was immense. Imagine dedicating your life to healing, then watching patient after patient die from conditions you can't diagnose, can't treat, can't even understand. The morphine addiction rate among frontier physicians was staggering. So was the suicide rate. By 1875, things are beginning to change, though the frontier won't feel the effects for years. Joseph Lister's antiseptic techniques are gaining acceptance in Europe. Louis Pasteur is proving germ theory. Medical schools are slowly adding laboratory work and clinical training to their curricula. But Silver Ridge is 1,000 miles and a decade behind the cutting edge. Cornelius hears rumors of these new theories through medical journals that arrive months late. He reads about carbolic acid spray and antiseptic technique with skepticism. Still, almost without realizing it, he begins to change his practice. He starts washing his instruments in boiling water. He experiments with the carbolic acid, spraying it on wounds before suturing. His infection rate drops, though he attributes it to improved air quality in his surgical room. In 1878, Cornelius attends a medical conference in Denver, his first professional gathering in 10 years. What he hears there shakes the foundation of his practice. Younger doctors are presenting papers on antiseptic surgery. They're discussing bacterial infection, sterilization protocols, proper suturing techniques using sterile catgut. They're challenging bloodletting, questioning mercury treatments, demonstrating that many cures are actually poisons. Cornelius realizes with creeping horror that he's been practicing medicine wrong for a decade. He thinks of Ezekiel Harding, the dysentery patients he bled and dosed with mercury. The dozens of post-surgical infections he attributed to bad air instead of his own contaminated hands. How many did he kill trying to save them? He returns to Silver Ridge a changed doctor. He scrubs his hands with carbolic soap before every patient. He boils his instruments for 20 minutes before each surgery. He stops prescribing calomel entirely. He reduces his use of bleeding, then stops altogether. His patients start surviving at higher rates. Word spreads. But the nightmares don't stop. He still sees Ezekiel's face, hears the sound of the saw in bone. By 1885, Silver Ridge has grown. There's a telegraph now, a railroad spur, a proper hospital with 2 rooms and 6 beds. A younger doctor has arrived, fresh from a medical school that teaches germ theory and antiseptic technique as standard curriculum. Cornelius watches this young doctor work and sees a different world. Sterilized instruments, rubber gloves, proper anesthesia protocols, post-operative care that includes changing bandages with clean hands. The mortality rate for surgery is down to 15%, still high by modern standards, but a revolution compared to the 40% of Cornelius's early career. The frontier is ending, and with it, the era of medical ignorance that defined it. But let's be clear about what we're romanticizing when we watch those old westerns. When you see the kindly doctor saving lives with steady hands and a black bag, you're seeing a fantasy. The reality was men doing their desperate best in a fog of ignorance, armed with tools and treatments that often killed as effectively as they cured. The bone saw didn't save lives by modern standards. It ended infections by removing the infected limb, usually replacing one death sentence with another. The medicines weren't cures. They were poisons administered in the hope that the disease would die before the patient did. A frontier doctor wasn't a hero. He was a man with 2 years of lectures and a bag of tools, standing between his patients and death, knowing that more often than not, death would win. And the worst part? They knew they were failing. They saw the patterns, even if they didn't understand the causes. They watched surgical patients die with predictable regularity. They knew in their hearts that they were groping in the dark, that half of what they'd been taught was wrong, and they couldn't tell which half. That's the real brutality of frontier medicine. Not just the physical suffering of the patients, but the psychological torture of the doctors who cared deeply about helping people and had to watch them die from the very treatments meant to save them. The next time you watch a Western and see the noble doctor extracting a bullet by lamplight, remember the real scene. Unwashed hands digging through torn flesh with a dirty instrument, introducing infection that would kill the patient 3 days later. Remember the amputation saw biting through bone while 3 men hold down a screaming patient. Remember the mother dying from childbed fever because the doctor didn't wash his hands. Remember Cornelius Whitfield and the thousands like him, good men practicing bad medicine because it was the only medicine they had. That rusted saw at the beginning of our story, it belonged to a real doctor who performed over 200 amputations in his career. His personal journal records that fewer than half his patients survived the month following surgery. He died in 1891 at age 48 from morphine addiction and what his death certificate called melancholia. We'd call it PTSD today, the accumulated trauma of a lifetime spent watching patients die from his own treatments. That's the brutal reality of being a doctor in the Old West. This documentary is based on historical research and verifiable sources. To overcome the lack of visual records from the era, images and videos generated by artificial intelligence were used to illustrate and dramatize historical events, seeking maximum possible fidelity.